So, namaste everyone. Welcome to another webinar or the panel discussion that we have. Earlier we had it in last month where we discussed about women's health in different perspective. And here again we are with a new topic, but again we need to understand the women's health in broader concept. So before we begin, let us invoke the Guru Parampara. Let us invoke these Shaktis before starting today's session. Join us. ॐ तद्गणेशाय विद्महे वक्रतुण्डाय धीमहि तन्नो दन्तिः प्रचोदयाते ॐ कात्यायनाय विद्महे कन्याकुमारी धीमहि तन्नो दुर्गा प्रचोदयाते ॐ वरलक्ष्मी च विद्महे विष्णुपत्नी च धीमहि तन्नो लक्ष्मी प्रचोदयाते ॐ वीणाय विद्महे वृञ्चपत्नी च धीमहि तन्नः सरस्वती प्रचोदयाते ॐ तत्परम्पर्याय विद्महे ज्ञानलिङ्गेश्वराय धीमहि तन्नो गुरुः प्रचोदयाते ॐ योग महर्षि डॉक्टर स्वामी गीतानंद गिरी गुरु महाराज की जय। ओम पुदवई कलमामणि पुदवई शक्ति योगाचारिणी अम्मा जी मीनाक्षी देवी भवनानी गुरु माता की जय। ओम श्री गुरुभ्यो नमः। हरि ओम। So namaste everyone. I will hand over today's session to our moderator, Yoga Sadhaki Neeru Parashar.
You're muted. I pay my humble pranams to the Guru Parampara and all the teachers and gurus of the lineage. And I welcome everyone for this panel discussion today. And the topic for today's discussion is Beyond the Pill, Lifestyle Disorders, Joint Health, and Yogic Care in Aging. As we age, many people experience different kinds of aches and pains in the body. People also experience lifestyle disorders like hypertension, obesity, or insulin resistance. And very often, the first response is to take a pill, a painkiller, or an antacid if you are suffering from acidity, or a sleeping tablet if you're not able to sleep. So, medicines are important and often necessary, but today we ask a very deeper question. Are we only suppressing our symptoms, or are we understanding the root cause of the problem? In today's case, we are going to understand about the aging body, lifestyle patterns, joint health, and how can we deal with all these things from a wider perspective. To guide us, we have three respected experts today present within us, amongst us. And one is Dr. Shobhana Jayaganesh. She's MD in physiology, and she's going to help us understand about the aging body, lifestyle disorders, inflammation, and joint function. Dr. Shamili Shankar, she's a pharmacologist who will guide us on medicine safety, painkillers, self-medication, and drug interactions. And Dr. Meena Ramanathan ji, she's a yoga therapist who will share how yogic wisdom can help us in supporting our lifestyle and overall well-being. So I welcome all the panelists today. But before we get into our discussion on this topic, I would like to request Nilachal Padmashanti, who is the CEO of Gita, the organization who is actually organizing this webinar, to give us an idea of what Gita is all about. So over to you, Nilachal.
Thank you so much, Neeruji. And as it was mentioned, we are a very special ambience, and here with a very ambience environment, I would like to just give a brief about this institution, Gita. And Gita is the acronym for Gitananda Integrative Therapies Academy. And just to give you a brief into that, here the therapy, if it means like it is an integrative approach, and it is a dynamic platform dedicated to integrative yoga therapy, education, and holistic healing, which brings together the traditional yogic wisdom and modern healthcare approaches, and creating a space where the learning, therapy, research, surveys, and lot of other things come together. And the Gita is understood under the base or the root of the yoga as a therapy, as education, and as a way of life. As a therapy, it supports health through a yoga chikitsa. As education, it is structuring learning and professional training. And as a way of life, it helps to cultivate the conscious and the balanced living. And it all started in like 24th July 2015. It was founded by our beloved Ammaji, and now on 14th January 2026, this year, we got it inaugurated. So this is a brief, and here we are actually trying to integrate different modalities, therapies, and while yoga therapy or yoga chikitsa remains central axis of our work or our sadhana or the seva, Gita also encourages the thoughtful and ethical integration of different healing systems such as allopathy, naturopathy, music therapy, siddha, ayurveda, and of course dance therapy. And we are including a lot more. And the purpose is not to mix systems randomly, but to bring them together with responsibility, and the well-being of the individual at the center. And as part of this vision, Gita conducts monthly awareness programs, and this, as you can see, that we have a panel discussion, focuses on different therapeutic approaches and healing traditions. What are the things that we can do and bring into the knowledge of everyone? And these sessions aim to create awareness, promote preventive healthcare, and offer simple, practical knowledge to people that can be applied in daily life. And with these, we have the blessings of our gurus, who actually are the energies or the divine force which are actually moving us forward. We are only the face that you can see, but the actual energy that we receive are from them, the blessings and the motivation, the inspiration, the knowledge, wisdom, everything. And in this whole setup, our dear Rishiputra, Dr. Anand Balogi Bhavanani ji, he actually helped us guide through various channels and helping us to understand how the integration can be done in a better way. So he is the guide, he is the person who actually help us to do all the activities, and he is helping us to get everything together. So he is the integrative force in Gita. So that is the brief, and I welcome you all. I hope you will be enjoying and learning a lot from this session. Over to you, Neeru.
I would now like to invite our director of Gita, Yoga Sadhaki Divya Priya Bhavanani ji, to say a few words before we begin the session.
Namaste everyone. Namaste, Vanakkam, Swagatam. And my best wishes to you. Good morning, good afternoon, good evening, or wherever you are based on your time zone. I welcome you all. So based on this inspiring theme with our inspiring panelists and the inspiring Gita team that we have here today, once again, this theme invites all of us to reflect on one question. That is, what does it truly mean to be healthy? Is it merely just the absence of a disease, or is it way beyond that? Is it about having a purpose in our life, a sense of purpose, having a sense of resilience that whatever comes my way, I'll get through it and I'll bounce back to where I was and ultimately become a better version? So, this theme invites us to that. And in today's world, what happens is, with the way the modern lifestyle and even the modern way of thinking is, what tends to happen is everybody looks for very quick solutions to their issues. So a pill or a medicine is something that can easily, be accessed and just taken, and they expect the results. But I don't think that is a good way to approach stuff. And especially with the way all the diseases are nowadays, it's psychosomatic, somatopsychic, and all of that. So I think the better approach will be having a comprehensive one, integrating, everything together that fits the individual. And an individualistic perspective approach is, I think, obviously the one that we all seek out for. And ultimately, it's not just addressing the disease, but it's addressing the whole person, so that physically they are better. So physical mobility is better. They have better social connections. Emotionally, they are more balanced. They have more mental clarity. They are socially, spiritually stable. And ultimately, as a wholesome being, they are, what we need on planet Earth, better human beings ultimately. And this, I think, resonates with our International Day of Yoga theme 2026. So it's not something that we just do, but it should become a part of our lives. So I would suggest that we all, instead of looking at adding more years to our life, we should look into adding more life into the years that we are, living on this planet, and be the compassionate and good human beings that we are supposed to be, and follow our dharma. So I'm welcoming all of you once again. And I really look forward to this session. And I thank Nilachalbai, Neeru ji for, this, and the whole team of Gita, and especially our lovely panelists, dear Sobana ma'am, dear Meena ma'am, and Shamili akka. I really look forward to this, and we look forward to this enlightening and enriching session. I'm sure that everybody will be happy that they chose to be here today in this time with all of us. Thank you.
Thank you, Divya Priya Bhavnani ji, for those inspiring words, and to give the message, or to kickstart the session with the strong message of yoga, that it's all about holistic approach. It's not a reductionist approach which we choose in yoga. So before we start the panel discussion, let me introduce to our expert panelists today. I'll start with Dr. Shobhana ma'am. Dr. Shobhana Jai Ganesh. She's a MD and PhD in physiology and holds a postgraduate diploma in music therapy. Currently, she is the admin in charge in School of Music Therapy at Institute of Salutogenesis and Complementary Medicine, Sri Balaji Vidyapeeth. She has published 30 articles in peer-reviewed journals, of which 9 are on music therapy applications. She has a copyright on the music therapy process for student wellness. MEETS, which is the abbreviation for Musically Express Your Emotions and Thoughts for Success, which has been delivered to health professional students for over a decade. Dr. Shobhana ma'am will help us understand the aging body again, lifestyle disorders, inflammation, and joint function. We welcome you, Shobhana ma'am, and we are looking forward to your guidance today. Our second panelist is Dr. Shamili Shankar. Dr. Shamili Shankar is a pharmacologist and medical professional currently pursuing her MD at PIMS Puducherry. With experience as an emergency medical officer and junior consultant in cardiac care, critical care, her work brings together frontline clinical care, pharmacology, patient safety, and rational drug use. Today, she will speak on medicine and women's health from practical pharmacologist perspective. Please join us in welcoming Dr. Shamili Shankarji today, and she will guide us on medicine safety, painkillers, safe medication, and drug interaction.
Thank you, ma'am. Thank you.
And now I welcome our third panelist for today, Dr. Meena Ramanathan ji, and she is a principal of School of Yoga Therapy, ISCM, Sri Balaji Vidyapeeth, and she is a certified yoga therapist and consultant from IAYT USA, and she's a long-term student of Ammaji and Dr. Ananda Baliyogi Bhavnani ji. And she is also a senior teacher and mentor of Rishi Culture, Ashtanga Yoga or Gitananda Yoga tradition. She has special interest in transgender population, and she has done a lot of work in special need children as well, or specially able children, I should say. She has more than 122 scientific papers, 3 books, 26 abstracts to her credit, and she's recipient of many awards. And Dr. Meena ma'am will help us understand how yogic care, safe movement, breath awareness can support us in graceful aging. So we welcome you, Dr. Meena ma'am. And this is just a short bio. And if you want to read more about these three panelists, please go on Google and you will find a lot of information about them and their work. So let's begin today's session with the grace of Guru Parampara. Yes? Okay. So my first question goes to Dr. Sobana Jayaganesh ma'am, and that is about aging. So today the topic is about aging. So we would like to understand what exactly aging is. What is your point of view on that, or physiological point of view on that? And is aging only about chronological age, or is it more than that? Over to you, Shobana ma'am.
Yeah. Good evening and good morning to all who have joined here. And I think this is the first time I'm being a part of Gita. My sincere gratitude to to Guruji and to the Gita team. Thanks for the wonderful introduction and a very good topic and the set of panelists. I'm really humbled to be here. So, Ms. Neeru, your question itself gives an answer for that. You asked me what is aging physiologically. So, anything physiological is normal. So, aging is a normal process which all of us have to undergo. And have you heard the word programmed aging? So all of our cells have the program in them. So what happens over a period of time, the enzymatic activity, the metabolism in all the cells slowly starts changing, and it reaches a point when the cells cannot function, and the death of the cell or is also programmed, which is called as apoptosis. So when you understand aging, starting from a small tree up to all the organisms, it is a program. Now, this program is different for each and every one of us, which is the chronological age. So, all of us have a genetic pattern in aging. If that is told so, all of us have a pattern. What is the purpose of today's talk? Yes, we can modify this chronological age. Both we can make it worsen by the practices we do. So we used to tell you are whom is based on your choices. So our chronological age or how we progress may change or worsen because of the habits we take in. If that is possible, we can also make it better by taking up better choices. So we have understood it's physiological, and apoptosis is programmed. A cell has to undergo various changes, is programmed. And I will just tell one term and we'll talk about it later, is epigenetics. Epigenetics is that branch of genetics which deals with how your choices or how your lifestyle can modify your genetical program. So it is a science. That's what we are going to see now. So we can hear from other panelists about epigenetics and also this chronological aging or chronological programming of our human body, how we can modify that.
Thank you so much, ma'am, for explaining about aging, because a lot of people these days, even though they are young, but they are still going through symptoms that we used to see at an older age, but people are going through the same problems now again at a very young age. So you said lifestyle disorders can speed up the process of aging. So could you please put some more light on that?
Yeah. As I told you, epigenetics itself is a branch which deals with how your choices. Disorders are because of bad choices or how your lifestyle can change your aging. Okay. So aging, as I told you, is programmed. There is a lot of scientific basis. A very simple thing what we would like to know here is everyone or every cell of us has a cap in it. We call it a telomere. A telomere helps us to function more better. It's like a cap. Now, all your bad choices will reduce the length of this cap. It could be so many things, starting from what you eat. Obesity may lead to metabolic disorders, can reduce this. Now, smoking can lead to oxidative stress. Alcohol can damage your liver. Less of sleep will damage your brain processing and cognition. Less physical activity will reduce your bone and muscle mass. Okay, so this is one spectrum. Now I have my other co-panelist will tell you about the other strip spectrum of what good you can do. So now epigenetics or all these multi-factors affect how the program in our body can be regressed or it can be disturbed, which leads to what you say is now our youngsters are prone to disorders which in a previous generation they got only after they are 60s or 70s. Now we see early onset diabetes, hypertension, all these things in a younger age is because of this concept of epigenetics or the lifestyle choices which we do.
All right. Thank you so much. So my next question goes to Dr. Meena, ma'am, because Dr. Shobna ji was talking about how people are now more prone to these lifestyle disorders and aging. From your perspective, from your practice, what do you see the main reason why people are going through this lifestyle disorders more than ever, or going through joint pain or stiffness in the body? So can you put your perspective on this same topic?
Namaste, good morning, good evening, good afternoon, whoever, wherever part of the world you all are. And at the outset, let me express my deep gratitude, one, to the tradition for, whatever we are. It is because of whatever we have learned from them and through them. Beloved Ammaji and Ananda sir. And Nilachal, thank you so much for this wonderful opportunity. It's really wonderful to be among such eminent panelists, such educated panelists. It is humbling for me. So thank you very much. Just wanted to say that, from the yogic perspective, whatever is there, Divya Priya has so beautifully compiled it. So she has made my job half less. And Shobna ma'am, she is also again said, so beautifully about what aging is, what is the chronological aging and all that. But I just wanted to add one more thing to what Shobna ma'am said regarding the epigenetics. It's like, I think it was, sir often gives this example. It was, I think, A.K. Das sir in one of the conferences had mentioned it. Epigenetics is like having a loaded gun in your head, right? It is there. It is a loaded gun. But whether you pull the trigger or not is in your hands, right? So pulling the trigger is in our, is what we are responsible for. So are you going to pull the trigger, or are you going to modify your approach to whatever you have been doing? So as we all know, aging is progressive. There is no way you can stop that, every second you are aging. But how do you address that? That is where, our approach to this whole thing is going to be different. Pain, as we age, we all know there's going to be plenty of aches and pain and, like the degeneration. It's very, very common as we age because of wear and tear, because of whatever it is. Physiologically, there are many other reasons also. But pain, like pain, is it just physiology? Is it just the body that is undergoing that pain? What is pain? Pain is something very, very unpleasant, right? You don't really enjoy pain, because it is something which causes, like it triggers something within you that you stop doing that activity, which causes the pain, right? So if you get up, in a particular way, and there's a sharp pain in the spine, so next time you get up, because pain triggers what is called as a fear, amygdala, limbic system. We all know about that connectivity, right? So fear is triggered, and then the previous memory, hippocampus, now brings in, okay, when I do this movement, I'm going to have pain, which is, I don't want it. So this memory, this emotional, fear, all this creates this limbus of, circle going around, and it is going to pull you into that vortex. When what happens is that because of all this, you stop moving, which is actually pulling you into that vicious cycle. Because when you stop moving, what happens is it creates more stiffness, and it creates more of, the joint stiffness, that it cannot move. And so whenever you begin that movement, it is going to trigger more pain, and it is not going to get any less. So how is it that we are going to break out of this vicious cycle is what we have to think about. So like I said, pain is not just a physiological pain. It is not just your body that is undergoing the pain. As we all know, yoga considers human being in a multi, dimensional levels, like where we have the Annamaya, the body, the mind, the energy level of existence, your intellectual and your whole spiritual level, which is, like it's all integrated. It is all interconnected. So the pain or aging or whatever it is not just physical. It is not just your body that is undergoing all this, right? So say for example, pain, why I'm saying that is because people understand that easily. So pain in the body, your body is experiencing this unpleasant thing called pain. But what is happening to your energy level of existence now? Is it going to be like normal? Right? Think about the interconnectivity again. So this is going to influence the energy level, which is again going to get disturbed. And think about your mind, which is undergoing this pain. The mind is experiencing the pain, right? So is that going to be emotional level also? It's all triggering, like fear, and then hopelessness, leading to helplessness, leading to depression. So one after the other, right? So it is pulling you in. Can we break open? There's something very, very simple. Yoga considers all these are interconnected, right? So can you just breathe? Can you breathe appropriately? Can you exhale longer and let that relaxation settle in? Again, when we talk about this pain, is it because of overuse of your body? Or is it because you have not used your body at all? Rajasic nature of the human beings, you're working, jumping, passionately. Everything is getting overused. It is abusing of the joints or whatever it is. But is it going to be that, or is it going to be the tamasic nature where you're going into the inertness, stagnation? So how do we come over all this is breathing. Because as we were talking about this limbic system, which is going around, what is in between that limbic system is your hypothalamus. So you breathe, you influence your hypothalamus, which is connected to your pituitary, adrenal. You all know about the HPA axis. So this whole thing can be reversed. Psycho, neuro, we'll talk about this more. Psycho,
Sure.
neuro,
Yeah. Thank you.
immunoendocrinology,
Yes.
blah, blah, blah.
Yeah, we'll
right?
talk about the solutions later on, but you have
Yes.
put it really well that how pain is not just physical and it can be interconnected, it can be emotional, it can lead to a lot of helplessness or depression or anxiety as well. And it can also deplete our energy. So now Dr. Meena ma'am has explained it beautifully what pain is all about and what chain it causes in the brain. I would like to ask Dr. Shamili ma'am about painkillers, because whenever we have pain, our first response is to take a pill, right? That comes really handy. So why do people go for a pill instead of making some lifestyle choices? Why is that happening to our generation more these days?
So, namaste everyone. I would like to sincerely thank Dr. Sir, Nilachalji, and the whole Geeta team for inviting me to be a part of this panel discussion. And my gratitude, sincere gratitude to the moderator Neetu for guiding through the session, and to my fellow panelists, dear Dr. Meena ma'am and Dr. Shobna ji, with whom I'm really honored to share this platform. So, on a personal note, I would like to thank my husband, Dr. Balaji, for his unwavering support and constant encouragement. So, it is a privilege to speak on the topic beyond the pill: age well, move freely, and live fully. And today I'm here to share a pharmacologist perspective. So, how medicines can complement but can never replace healthy living. This is what my focus will be today. So, what people often assume, like as a pharmacologist, my role, what they think is my role is only to recommend medicine, but it's not that. But today I would like to begin with a very important statement. I will say that medicines are valuable, but they are not magical. So when it comes to aging well, so what it's important is the preserving the mobility, maintaining the independence of the individual. So medicines can only become one part of the picture for this. But how we eat, how we move, how we sleep, how we manage the stress, and how we care for our bodies, that plays a very important role in our lifestyle. So coming to the question, my simple answer is medicine, it gives a quick relief. So that is the very simple answer for your question. So if there is someone who has a knee pain or back pain, or example, the person has a stiffness in the morning. So what naturally what we think is taking a painkiller, it may reduce the symptoms within few minutes or few hours. But lifestyle intervention like weight reduction or a strengthening exercises, yoga, or if we improve our posture, if we quit smoking, alcohol, or basically if we improve our sleep, that may take months or weeks or months like that before the noticeable benefits it appears. So the symptoms will be quickly relieved if we take a painkiller. So that's what I said. Medicines they give a quick relief. And we now live in a culture where we want instant results. So we expect rapid solutions for most of the problems. So naturally, when people ask a doctor, just give me a tablet, because I want a quick relief like that. And I think there are several reasons for this behavior. First is we are like now in a like a race. So what the pain, it will interfere with the daily life. So because of this only, people we want the immediate relief, so that we don't have to stop. So we can continue working and we can continue taking care of our families. So we don't want the pain to disturb our daily life. So I think that is one of the main reason. And then there is limited awareness. I feel there are limited awareness because many individuals, they do not realize that lifestyle factors, they significantly have a influence on the chronic pain conditions. We do not realize the value of lifestyle factors, and like time constraints also, because if we want to change a habit, and it will not take one day, it will require a commitment, it will require a constant support and patience. And I think that is lacking a little bit for us. And then there is as ma'am said, there is fear of movement also. So once the pain arrives, people, they tend to avoid the exercise, because what they believe is if I do a exercise, again the pain will worsen. So they have a fear of the movement. And finally, I think the social influences are also there. We are constantly exposed notes, like messages, like we want a quick relief like that. So the social influence are also there. So many conditions are associated with aging. but which are strongly influenced by lifestyle. For example, if I say if there is excessive body weight, it will have a stress on the knees. And if we have a sedentary lifestyle, it will have an effect on the joint. And if we take poor nutrition, if the nutrition is not good, there will definitely be deficiency. So it will affect the bone health. It will affect the overall health also. And even sleep, if there is no proper sleep, there is chance that the perception of the pain will also increase because of the improper sleep. And if there is a chronic stress condition, so that will also lead to inflammation. That will increase the having inflammation. So therefore, if I say medicines, they can control the symptoms, but they do not address the underlying contribution because why the pain is coming. So that is not addressed with the medicine. So as healthcare professionals, what I think is our responsibility is not to suppress the symptoms, but we should allow the people. So we should give an option to adopt a healthier habit. We should teach them. Should create awareness to support the long-term well-being.
All right. Thank you so much, ma'am, for putting some light on the medicine. And I like that line that medicines are valuable, but they are not magical.
Magic.
We have to deal with a bigger picture. So that takes me to Dr. Shobana, ma'am, to my next question, because Dr. Shamili ji was just discussing about lifestyle changes and how stress and other lifestyle choices can bring a lot of joint related issues in the body. Usually when we talk about joint, we just think about the physical body, the joint itself, but we don't look at the other stressors of our life or changes or how we are sleeping or eating. So can you put more light on about lifestyle choices, how it affects our joint health, aches and pains in the body, and what we are doing today, is it going to affect our future tomorrow?
Yeah.
Over to you, ma'am.
Yeah, it has been a wonderful setting to the scene by Dr. Meena Madam and Dr. Shamili. Thank you for that. So we earlier started that there is a separate branch, epigenetics itself, which tells us how all these lifestyle changes are affecting our genetic pattern. Yes. Before that, when the cell starts behaving in an abnormal manner, the cell death or aging happens. So that determines our chronological age. So they say you cannot modify your chronological age. It is pre-programmed. But biological age is what is because of how you behave, what you do. You can modify your biological age. So we'll just try to see how this choices affect our aging. So as told, cells do their metabolism or functions every second and every minute, and all our habits influence the cell metabolism. For example, you just take simple breathing. The amount of oxygen we take in by a rapid breathing when you are stressed, and the amount of oxygen you take in by a deep breath is totally different. And there is also a mythology or a belief that a person's age is equal to so many number of breaths he take. In our mythology, we have that. So it indirectly denotes that slower you breathe, you have years together, isn't it? So it adds up. Now, I have taken a simple concept of breathing. Now, let's see how much it influences your aging. Yes, the slower you breathe, your heart rate reduces. Now, when your heart rate reduces, you immediately shift from the sympathetic to the parasympathetic tone or the vagal tone. So you get a balance of it. And I would normally say that if I want to calm down, I cannot reduce my heartbeat directly, isn't it? But my breath is under my control. I can reduce the number of times I breathe in a minute. Or very simple, I take deep breaths. So once I take deep breaths, my count or my respiratory rate reduces. This will reduce my heartbeat and I immediately calm down. I used to tell my daughters who are in the IT field, she will say, I am fed up, so much to work. I'll say, you just take 1 minute. That's enough. Count 5, inhale and 5 basic, or if possible the box breathing and all. Just do for a minute, you will see the difference of how it is. And I would say my relatives and patients, who have hypertension, you need not do anything. Every hour you take 2 minutes of your own, just count and do the deep breath. So when we just started off how lifestyle changes affect aging. So starting from how you plan your day. Is it like rapidly you think of doing what next, or you put a halt here and there and you mindfully do things? Yes, it determines which nervous system in your body is acting. When I always think, okay, now at 7:30 webinar is going to start, what will I say? Immediately I start, my heartbeat starts rapidly moving. But if I am mindful, it slows down. So being mindful, taking healthier choices, starting from the diet you eat, by the physical activities you do, all these determine how you age, or all these determine how your cells function. And we are made of trillions of cells. So all the cell metabolism finally determines your biological age. As I started, I cannot change my chronological age, but I can decide how my biological age is going to change. Or even if my number of my age is increasing, I can decide how energetic I am, how functional I am. So that is how we can modify our aging process.
So I just want to ask you something about joint conditions, specifically osteoarthritis, as
Yeah.
our bone-related issues. So is there any direct connection between metabolic syndrome or, we have like obesity, insulin resistance, or you can talk about stress also. All those things, do they have direct relationship with the arthritis, joint-related issues in the future?
Yeah. So one very interesting thing, like all the parts of our body, like we know our skin, our hair falls every day and hundreds of hair grow. Our nail falls and it grows, like that. Our bone is not a stationary structure. I don't know whether everybody knows that. Bone is hard outside and inside there is a cortex, and every minute old bone is moved away. That is called as bone resorption, and new bone is formed. So bone is in a continuous turnover process. Now this turnover process can be accelerated. You can have new bone formation. That means you can overcome osteoporosis. Osteoporosis is breaking down of your bone, but you can make the bone to grow, to strengthen by the exercises you do. So when you exercise more and you put more stress to your bone, there is new bone formation happening. And in contrary, if you don't move, if you don't work, your bone slowly as you age undergoes resorption or undergoes damage. Similarly, your muscles also, proportional to how much you work, they start growing. The proteins grow and the muscle mass grow. And the other end, if you don't use it, they start decaying. So there is a decrease in the muscle mass. We call it as myopenia. So there is osteopenia, is the bones density is less and muscle mass is less. All these things happen with aging, but working out your muscle, working out your bones, and being active physically can revert all these conditions.
All right. Thank you so much, ma'am, for explaining it beautifully. I would like to move to Dr. Meena, ma'am, because we are talking about movement and how it is important, to reverse or sometimes to build that bone strength as well, health as well. So, from yoga therapy perspective, what are the common mistakes you see when people start moving, especially when they have pain in the body? you mentioned how they are scared of moving in the beginning, and then if they're moving, if they're exercising, what are the common mistakes they do?
Yeah. So the first thing is like, as a therapist, what we need to understand is, are you treating the pain or are you treating the person who is experiencing that pain? Right? So that is where the whole of the scenario can be changed when yoga therapy, like the Shamili and Dr. Shobana ma'am were so beautifully talking about lifestyle and how aging can, using your muscles, all this movement, everything they've so beautifully said. So if they stop moving, you know what is going to happen, right? So yoga therapy is like to help that individual. So we approach that person as a holistic person, as a holistic individual, and we do not approach the pain, right? So what is it that they are using wrongly? Means that is the, so let me approach that in a two-pronged way. One, as a therapist or as a teacher who's going to guide a person in the practice session, and two is from the perspective of the person who's doing the practice, right? So that as a teacher we need to understand ahimsa. That is our first policy, that even if you're not able to help, cause no pain. That is there. And from the perspective of the practitioner, the sadhaka, they have to listen to the body. They should know where to stop or how much they can go. Because in an over enthusiasm while doing the practice, if it is not stopped at the right moment, it's a very thin line between strengthening and what is called as strain. So we do not want to strain already, which is, the painful joint or whatever we are going to be working on now. So the wrong things, the faulty things that usually people do is, like I said, they do not listen to the body. They should know as much as how much they can do, how much they can push. They should also know where to stop and when to stop. And majority of the people, when they come for a class, they keep thinking that you have to keep on moving, but is enough or equal importance given to relaxation? And every movement, is it accompanied with breathing? Because when you're moving, if the movement is accompanied or synchronized with the breath, you know where you are overdoing. Because say, for example, you're bending laterally, right? So this is your limit to bend. But if you're going beyond that limit, what happens is your breath stops. So if we are aware, we will notice that. So again, listening to the body, right? So you should know, the practitioner should know where to stop. But let me tell you, there is a beautiful quote: motion is lotion for your body, right? I think I'm borrowing it from Farzana. She mentioned, about this when she had the cycle program, when she did that. So motion is like lotion for your body, whether the joint it is or whether it is your muscle, whatever it is like a lubricant. So how much are you moving? The other thing that people do is too much of activity, fast activity. They push too much, and where are you stopping? It's like, the car should be given the accelerator so that the car moves, but we should know where to apply and when to apply the brake, because the car cannot be moving constantly forever, right? So we need to know where is our destination, where to stop. And the joint should be moved regularly. Your body should be moved regularly, systematically. Like Ammaji says, regular, repeated, rhythmic movement. Whatever we are doing, please think about this regular, repeated, rhythmic movement. So there should not be any jerky movement, because jerky movements triggers more pain. So again, the muscle goes into that state of shock or stiffness, and you tend to withdraw the movement immediately, right? So that should not be there. So whenever the movement is synchronized with breathing, there will be no jerky movement, because it is a controlled movement you're doing. With breath, you're going to be inhaling and taking your hands up. With breath, you're going to be exhaling. So you know where it is going up to. So that is something which is very important also. And so jerky movement, synchronized movement with breathing. Breathing is very, very important, because again, now what is happening because of this pain or because of all, whatever factor it is, the connectivity is temporarily lost. The mind, body, we were talking about all the dimensions of the human being. The connectivity, there, the harmony, the integration is temporarily lost. So what is happening now? Why is it lost? Because of the fear, because of the pain, whatever reason be it. So how can we bring it together? The simple solution is breath.
All right,
Again,
ma'am, you have put
like,
it really nicely. Yeah,
yeah,
because in the modern society, we think more is always good.
no,
We live in those times when, people think we have to keep doing stuff instead of relaxing. So the balance is really important. So I would now like to go to Dr. Shamili ji, and I would ask you about the self-medication. These days we do self-medication. So what are the mistakes which we do during that, when we are self-medicating? Number two, what are the side effects? Because when we are getting instant relief, we don't think about the side effects. So
Yeah.
would you talk more about on those lines? Yeah.
So, so when we think about the self-medication, so I think it has become very common nowadays, mainly for the pain part, like especially for the joint pain, the body ache. So because for this, the self-medication has become very common, and this is one major mistake is that what we are doing is there is frequent use of over-the-counter pills. Like we are directly going to the medical shop, we are getting the pills. So that is called as over-the-counter painkillers, and that without any professional guidance. So that is the very common mistake which we are doing. So what people tend to do is they take painkillers sometimes every day also, because what they believe is what they think is, okay, last time I had the same pain, so this time also it will work. So one they think like that, okay, this is like exactly like the last time, this pain is like the last time, so I will take this same painkiller I will take. And one and another thing is, and it is available easy also. I can with the prescription, or even if I know the name, I can go and ask to the pharmacist and I can get it. So it is very easily accessible. And another thing is everyone takes it. So if my friends, they told I have a same pain, I took it. So like that, these are some of the common belief which people have. And 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 also they think it is like it's very easily available. But what I want to say is it is not completely harmless. There is some amount of risk with all the medications. So if we are taking any medicines for prolonged period of time, or if we are taking an unnecessary medication, if we have pain for some reason and we are taking extremely different painkiller for that, so there is a chance of various side effects, like something starting from a normal GI irritation, like sometimes people can experience a vomiting sensation, epigastric burning sensation. It can lead to severe ulcers also, bleeding ulcers also. And sometimes it can lead to kidney impairment also. Patient can go for chronic kidney injuries because of the excessive use of painkillers. And then it can raise your blood pressure. It can lead to some conditions called as fluid retention, which will eventually lead to breathing difficulty. And if the patient is an aged patient, because we are talking about aging, and the patient is having risk, susceptible patients, they have increased the cardiovascular risk also. And another common mistake which I am seeing is taking health supplements. And just in and out, people are taking health supplements. So people, they often purchase, they'll just get a calcium tablets, vitamin D tablets, collagen tablets, herbal supplements. So they just they believe the advertisement or whatever the relatives or neighbors are saying, all the recommendations from them, and they never consult. I have never seen anyone consulting a doctor for taking a supplement. So we should always see, do we really need the supplement? If there is a need, if are we having any deficiency so that we need the supplement? So we tend to think more is better, but more is not better. And the third mistake is we are ignoring the cause of pain. We have to go to the root, why the pain is there. Just masking the symptom is not enough. So where is the joint pain, if we speak about, for joint pain itself, there are various reasons like osteoarthritis. It can be due to rheumatoid arthritis. It can be due to vitamin deficiency. Thyroid disorders can also lead to joint pains. Various infections can also lead to joint pains, osteoporosis, and some medications. Like if we are we are having any chronic disease, that medication can also lead to joint pain. So for joint pain itself, so many causes are there. So we have to go to the cause. If we avoid the cause, the pain will eventually subside. So repeatedly, instead of masking the symptoms, we should already have a proper diagnosis and properly treat accordingly. So finally, many individuals, what I have seen, they do not inform the healthcare providers itself. If we are going for some reason, we should always inform what medications we are taking, even the supplements also. Because in our pharmacology, there is a term called as drug interaction. Okay, no, two common drugs will always interact with each other. So if we are going for any condition like fever or abdomen pain and we are taking any other treatment, we should always inform our doctor so that they should know what two drugs they are taking and can these two drugs can be taken together or not. So before self-medication, it should not replace the professional assessment. Okay, so that is what I want to say.
Thank you so much. Because I was going to ask you what is the safest way, because one cannot sometimes avoid medication,
Yeah.
but the safest way is to consult the doctor and before just doing self-medication. That is very important. So before we go to the audience for questions, I would like to ask Dr. Shobana ma'am to just summarize everything, and what would be your advice to people, or when it comes to joint health, what would you like to say in short?
Yes, as I started, our aging, our health is in our hands. So one line is be mindful, listen to your body.
And Dr. Meena ma'am, what would you like to say? What daily habits should one incorporate in their life to stay healthy or to manage? Because prevention is one thing, management is another thing. So what would you like to say about it?
Regularity in whatever you're doing, right? Even if it is going to be 5 or 10 minutes of practice, it should be regular. Instead of having like 1 hour practice for once a week, 1 hour, 2 hours continuously pushing yourself, and then the next whole week you don't practice. Instead of that, regularly, can you do it 10 to 15 minutes? And the other thing which I think is very important for us to understand is, are you going to fit into the practice, or are you going to adapt or modify the practice to fit into your condition wherever you are right now? So there's a big difference, right? So that is something. And the most important other factor is, like we all have been discussing about, hydration. Focusing on hydration is something which majority, like we tend to forget it, right? Hydrating, especially as we are aging. Ma'am has taken a bottle. Especially as we are aging, you don't feel thirsty. You don't feel like drinking water. And only after a meal you just have a half a cup of or 1 cup of water, that's it. But hydration is so much essential for the circulation, and as Shobna ma'am so beautifully said, how interconnected these things are, right? So plenty other things are there. I'll stop right for now.
And Dr. Shamili ji, what would you like to say at the end to all the audience people who are present here?
Yeah. So one thing, medicines, it should not substitute for healthy living. So a tablet, it should not replace physical activity or good nutrition, sleep, stress management, social engagement. It should not replace. So we should recognize that all the medicines, it carries benefits and risk. And there is a principle in pharmacology which we always tend to imply to the patient, that is for rational medicine use. That is, use the right medicine at the right dose for the right patient for the right duration. So it's not about avoiding medicine or overusing medicine. And I want to conclude that should be an ideal approach. We should combine the scientific evidence with what the individual patient needs, along with the major chunk of lifestyle modification. So integrating all three is really important for a healthy aging, which is our topic today. Thank you, ma'am.
So the key message is, right, as Swami Gitananda ji says, right useness. Everything should be done in moderation and right useness, because health and happiness is the birthright, is every individual's birthright. So now I would like to open the discussion, or to the audience. If you have any questions, please, you can unmute yourself and ask. I see one question from Poonam. Mahatani ji, would you like to unmute yourself and ask? So is it to any particular panelist, or anybody can answer? So yes, go
Yeah,
ahead.
it can be to anyone. I'm just going through a state of menopause currently. And like I've mentioned, there's a L3, L4 dyster. I have some edema, inflammation into it. And I just checked, I have this diastic recti also. And people are advising me for HRT patches. So I just want to know, do the hormonal patches are needed for us because of this bone degeneration with osteopenia? And like how doctor said, I do take supplements. I haven't consulted any doctor, but reading on the books and everything, yes, I'm taking calcium citrate, omega, and D3 plus K2. So I just want to know how, I mean, knowing there is osteopenia, knowing there's a bone degeneration, and how can yoga help in this? Because for now, I'm taking help of Ayurveda for their massages and doing vasti and something. And currently, I'm just resting so that, my bones, my spine relaxes the inflammation. So, yeah.
Would anybody like to answer? Because this is not about personal diagnosis, because you need to meet maybe some professional one-on-one. But if any panelist, any one of you would like to answer general basis, what would you like to say?
Regarding the patch, I think I would let Dr. Shobana and Dr. Shamli handle that part. Regarding the yogic aspect, I can give in something later. Let them finish this.
Yeah.
Yes, Dr.
Yes,
Shobana ji.
Dr. Shamili.
Ma'am, actually, if I'll just tell about the patch. So the HRT patch, so what usually it has estrogen. So now because of the menopause, so they are giving a supplement so that it avoids your menopausal symptoms, because it tends to be very severe, like hot flushes, night sweats. There will be mood changes. So avoid that. The HRT patches they are advising. And if we are asking about the L3, L4 disc tear, I don't think it's the patches and the L3, L4 disc tear are related. For the disc tear, you need a weight management or your physical activity. Yoga can be helpful. But the HRT patch, it will not heal the disc tear. It will be useful for your menopausal symptoms alone, ma'am. for your pain and for the L3, L4 disc, your spine problem, I think physiotherapy or the core strengthening exercises, the yoga, that will be more helpful.
Yeah. So can I add, actually, you have 3 separate issues to manage. One is the disc, that is a surgical problem. It need not be surgery, the L3, L4 disc tear and diastasis, because we see a lot of people. You can strengthen your disc by doing a lot of physiotherapy exercise. I would say yoga is a step of physiotherapy ahead. Like physiotherapy, it is only physical. There we add in the element of breathe and mindfully doing it. So with that, you can try. If it is minimal, you can overcome the problem of your L3, L4 disc tear. If not, then you have to go for the expert for surgical management. Number 2, HRT is now safe. With the doctor's prescription, you can go in for HRT instead of denying your body from the estrogen source. Number 3, taking calcium, omega, vitamin D3 without prescription is not good. Please go ahead, have a guidance from whoever consultant is there, and take the medicine.
So I think she also asked about the approach that we can do through yoga, right? So as she is, Poonam, as you are already undergoing the Ayurvedic massage and all that, you should know about what we call as dinacharya. And you are resting, which is the right thing to do because you have severe pain in the back. Resting is good. But as you're resting, you can do a few joint movements, simple movements. And dinacharya is like, are you in tune with the circadian rhythm? Are you mindfully doing all these things? So you don't have to be the victim of pain. You can come out of it with conscious living. Are you eating well? It is not just one approach, right? All these issues that you're going through is not just one approach. Are you eating well? Are you mindfully eating? What needs to be eaten? Ahar, vihar, achar, vichar, everything matters. Like your whole lifestyle that you are adapting right now matters, right? So think about it, and simple breathing practices can always be done from the from the bed. And are you using the nada, which is going to be healing you from within? If I have 2 more minutes, I can share my experience. Do we have 2 minutes?
Sure.
Yeah. So during Poonam, whatever you have been sharing during my menopause, what happened was I had this lumbosacral compression, because of which I had severe back pain, and all the doctors prescribed that don't do yoga. It is contraindicatory. They were, diagnosing it as stenosis, where you should not be doing, so bed rest. But being me, what I did was I did yoga. Of course, I did. But is it going to be forward bending? Is it going to be backward bending? Is it from the bed that you're doing? Whatever it is, but please keep moving. Don't stop, because if you stop, things are going to get stuck. Things are going to stagnate. So please move. Just gentle movements, whatever you can, whatever possibly can be done, from your current situation. If you want, you can take the help of a yoga therapist, a qualified person who is there. You can approach Nilachal if you want. But this truly helped me. I'm sharing you my experience, and now I'm completely out of that. So that is something which is important. Move.
Thank you so much for your feedback, ma'am. And again, this is a general guidelines. Please consult your doctor before you do anything. And it's always important to work one-on-one with some expert and not do self-medication or self-treatment, as we already discussed. And I would like to now invite Ingwen to say a few words at the end. If you would like to add something, Ingwen.
Thank you. And thank you for a very informative session. Yes, I think it's very useful for us to know about what is healthy aging for our own sake, for relatives we have, and also if we are going to work as a yoga therapist. And I think it's a lot of times there's so many choices to make, even if you don't feel any pain, even if you don't have any health issues. And I find myself, if I get some prescription from the doctor, then I'm not sure after the problem is solved, like high blood pressure or other like iron deficiency, you're uncertain afterwards whether to stop it. And also about Ayurveda, I use a few Ayurvedic health supplements, and I have consulted with an Ayurvedic doctor, but that's not very well known in Norway. So my general doctor doesn't know much about it. So there becomes this combination where I feel it's difficult to find out about it. But so you cannot self-medicate, but at the same time, it's sometimes you have to really use your own judgment. But of course, it's better to get some input from people who know. But I feel all of us, we need to be conscious about how we age. And I think some of the best advice is, like we have heard here, to continue to practice yoga, to continue with movement, and really to be very conscious that we have choices where we can make our aging so much better than if we don't do anything. Because it used to be, at least in this country, and also I've seen in other countries, if you age, you have to just put up with all the pains and aches and just let it come. No, you don't. You can avoid a lot of it by your choice of lifestyle and being conscious about your options and choices. That's very important.
Thank you so much. Yeah, thank you so much for your words. And at the end, I would like to invite our Yog Shaktima, Shaktima Devasena Bhavnani ji, to just give us 3 points, three advices you would like to give to all the people, whether they are aging or not, from yogic perspective.
Namaste, everyone. Happy to be with all of you. Yes, as a professional, everyone gave every point, actually. So, yes, as Swamiji said, the yoga life as a yogic way of life, and in the life, on time eating, on time sleeping, that means early, going to the bed early and getting up early morning, and usual like our culture way used to be. So always for everything we are in touch with all the Pancha Mahabhutas, with the Jala. Still my college madam used to be teasing me. Always Devasana means she's looking for jalam, 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 always like that. So drinking lot of water also, yes, record. And yes, always we are connected with those things. And if you are following, it will be very nice. Of course, like anything like a dancing, music, playing the instrument or singing, anything will be helping, or just simply going to the temple even really helpful lot, even though I'm not really like before as much as I used to perform and practice, not in the same level of practice or the performance, but still I can go for some level, means just still some connectivity. And yes, just the 3 things mainly, if you are following, I think it will be helpful for everyone, utmost keeping our...
Sorry, I'm on mute. Thank you so much, ma'am. It's always nice to hear from you, and you bring, your thoughts, and it's always refreshing. So before I end the session, I would like to thank all the panelists to share their wisdom with us today. And I know it's never ending, and there's so much information available, but it's always good to hear from the mouth of experts. And I would like to also thank Nilachal Padmashanti ji, CEO of Geeta, to organize such beautiful events online. And we have a lot of events here online which you can attend every month. He comes up with a lot of different topics, and we have different experts who discuss the topics. And not last but not the least, I would like to thank our teacher, our Guruji, Dr. Ananda Baliyogi Bhavnani ji, who has brought or given us this platform where we could discuss all these things together. Okay. All right. Thank you. Over to you, Nilachal.
Thank you, Neeru, and thank you so much, everyone. It was a very informational and very interactive, and it was very helpful for many who are here, and will be helpful for many who will be watching it online later. So thank you all. We will finish with the Loka Samasta, requesting all to pray for the wellness and good for all. Loka samasta sukhino bhavantu sarve janaha sukhino bhavantu. Om shanti shanti shanti. Om. Thank you, everyone. Thank you for moderating today's session, and thank you, everyone. Thank you so much. See you again
Thank you so
later.
much.
Namaste and pranam.
Thank you, Nilachal.
Thank you all.
Thank you all.
Neeru, thank you. That
Thank
was
you.
really wonderful.
Thank you, ma'am.
Thank you.
Thank you so much.
I would like
Thank
to
you,
give my
Neelachal,
heartfelt
Neeru.
gratitude
Thank you,
to all the participants.
Devasena.